Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Sharlee Dixon. My guest today is Anne McSweeney. Anne is an LCSW and the visionary founder of CEU Creations, a premier provider of live interactive training for helping professionals. After 20 years in the field, Anne is on a mission to eliminate boring continuing education by replacing compliance checklists with immersive, community-rich learning. Through her work with both CEU Creations and CE for Less, she's building a multidisciplinary hub that gives social workers, nurses, and counselors the real-world tools they need to thrive. Today, we're exploring how Anne is revolutionizing professional development by moving away from boring events towards story-driven learning that fosters deep clinical breakthroughs and genuine human connection. Anne, it's so great to have you on the show. Thank you so much for coming.
Thanks so much for having me. I'm excited to be here with you guys today.
Absolutely, absolutely. And we were speaking right before we started taping today about, boring CEUs and how, as a helping professional, we have to have them for our license. So I'm just curious, how did you create CEU Creations out of very boring CEU experiences for 20 years? Like what was that moment that brought you to create CEU Creations?
Yeah, so I came from a medical social work background. I did hospice, home health, and dialysis social work. So I was for about 8 years, what I would call it, doing in the trench social work, face to face with my patients and clients. And I always say I learned so much from them and take a lot from them in terms of what the difference I want to make, right? So I want to change patient and client outcomes. We've got that continuous learning that we are supposed to do as helping professionals, right? In order to learn what's a new best practice, what are new things out there. But CEs have gotten a really bad rap, right? They're known to be boring and expensive. So about 20 years ago now, I was sitting in a CE in downtown Atlanta in person. I was really bored and I was like, this just could be done so differently. And it was like a light bulb went off because at that time I was actually working with an elder law attorney. I was his liaison to the community. So at that time I wanted to be talking and in front of social workers and case managers and what we talked about was really important. We did a lot of things around long-term care, probate, guardianships, death and dying, end of life. Things that helping professionals often deal with on a day-to-day basis. And I thought, why not try CEs with my attorneys who are great speakers? And that allows me to be in front of that target audience of these helping professionals. Did my first CE and just started doing them. And people would come up to me and say, your CEs are so good and so different, but why are you just doing elder law topics? So that's how CEU Creations was born. So it's a way to make CEs affordable because we often work with sponsors that want to be in front of helping professionals as well. So we are able to bring our prices down, sometimes even making them free. And then also the engaging piece of it. I want our learners to take something away, to take resources away, to be engaged and to have a good day off that they're attending that CE or a good few hours off. It might be a lunch, it might be a 1 hour. I think it's possible. I think you can learn and have fun at the same time.
Absolutely, absolutely. And you mentioned a lot of things that I want to, touch on as we, continue our conversation today. One of those things is how, as social workers, and like you, I am a dialysis social worker. So I am in those trenches and have been for quite a while. Before dialysis, it was in education. So I've always been in that front line, hands-on, working with the people. And something that you said, you said that patients take from us, and not that that's necessarily a negative thing at all times, but a lot of times the CEs that we often are able to take or can afford to take, or that our employers sponsor for us, are not necessarily things that really enrich what we need in those moments. Things like you mentioned, the elderly law and things that we weren't necessarily taught in school that we do have to figure out. Some of that OJT that we've got going on. How do you say that your background in clinical social work influences the way that you create content, specifically for us professionals who are often emotionally taxed or just burned out?
Yeah. So I think, over the years, as I've my role has shifted to more of what I would call macro social work now, right? So
Mhm.
I'm more in education, creating content, working with our teams to work on really engaging and different content. And so it's always in my mind as we are creating our courses at CEs that these are hours or, it could be 1 hour, it could be up to, sometimes our CEs are 2 days and it could be up to 12 hours, something like that, that
Nice.
the helping professional is taking time out of their day that they're not doing their regular job. And so it's always in my mind that I want that time to be I want them to get energized. I want them to get excited about learning. So as we're putting our courses together, I'm thinking, what's the topic? How can we make this topic different and unique and still meet the criteria of the boards and all of that, and allow the helping professional that attends to gain resources, to gain techniques and best practices that they can leave the next day and they're energized. They're like, wow, that was a really great CE. And also having connected with fellow helping professionals out there. I think the chat is a really great feature that helps people do that too and really helps us connect too in this crazy busy world of like remoteness all the time, right? So I think that helps as well.
I completely agree with you. And in many spaces, actually every job that or social work job I've worked in, except for child protective services, the social worker is the only social worker in the building. Often the same for
Oftentimes, right.
counselors, you're kind of by yourself. And I agree that having a chat feature in a CE course, it can be really, really helpful to just figure out who else is out there and you don't necessarily just feel alone in whatever you're dealing with.
Exactly. And you might be sharing resources, right? So maybe we're talking about a common problem. And what's so cool is because being remote is kind of a double-edged sword, right? You may feel isolated, but then on the same thing, you may be able to connect with speakers that, I'm in Georgia, so I might be able to connect with a speaker from California or from, across the country. So you can really learn. And the same with the learners and attendees on our events. They're from all over. So you might know a resource or a best practice or something that somebody else doesn't know that you can share as we're on this CE. And it kind of warms my heart when I see people doing that because I think that they get a lot from that too, that connection with others as well while they're on
Absolutely.
the events. Cause we're not so much in-person events. They happen, but not as often anymore. And so to me, this is a way for us to connect, but we're still online through
Absolutely.
that
Absolutely.
chat.
Takes networking to another level. It's in the world of being remote and not necessarily on a lot
Exactly.
of in person. Yeah.
Exactly.
Completely agree. So, how does CE Creations? How do you create that level of engagement? So it's not just the chat, right? So what else do you guys do to create that level of engagement that has kept you guys going for 20 years?
Yeah. So, well, CEU Creations, at first, when I first started doing CEs back in the day, they weren't through CEU Creations. CEU Creations was started in 2010 officially. So we've been around now, 16 years this year. Wow. It's crazy. Time flies. So again, I'm always trying, it's just the way my mind works. And and I think that's one of the things that I love the best about what I do is that creative piece, right? I almost look at it like an artist. How can I take this CE that, we do have the constraints that we have, you've got to have evidence-based and peer-reviewed articles, and we're always going to have those pieces. But how can I sketch in and draw in and make that more creative and more engaging? I'm going to use storytelling. I'm going to use, can a patient come and tell us their perspective? Because if I can learn that perspective from a patient, when you think about how different things can be presented as we were talking about dialysis social work. We're both we both did dialysis social work, right? So we could go up and talk about, dialysis social work, what it entails. We could talk about the patient experience, but we are not dialysis patients. So when you bring like let's say that was a CE on dialysis, when you bring that patient, it enriches the experience. They're drawing that crowd into them, like you want to hear because we don't know really what it's like
Yeah.
to walk in the shoes of a patient. And so, how can we do that from the patient perspective, from storytelling, any of that?
I completely agree that telling a story really does bring in a level of engagement that oftentimes you may not get from, from any other type of webinar, even where you're not engaging, or somebody just has a PowerPoint slide. Not to say that those things are not necessary and you do not gain information from them. Little sidebar there.
Right,
But I
right,
do agree that,
right.
storytelling really brings information home. But then I wonder, how do you connect storytelling with, the performance based or evidence based things that we have to have requirements, for our boards to approve them?
Sure, sure. So it's almost like building a house, right? So you've got your foundation, and we know what we need to do for the boards, and we're always going to have the evidence-based, peer-reviewed articles and journal articles and things that we need, and we're always going to have speakers that can speak to all of those more didactic pieces, right? But again, I want to sketch into my events that storytelling piece, the piece that's going to resonate with the audience. And, let's face it, our audience, they're on their phones. My goal is like to get them off their phone for 5 or 10 minutes, right? So if I can draw them in to a story or to a patient perspective, then they're more likely to listen to that didactic piece because they've heard that story and they're like, we want to help this person. And then they realize, hey, this person could be one of my patients or clients. Or, it could be something that I might see in a few months, weeks, years, whatever. Hearing that makes them it reels them in. It makes them want to pay attention. It makes them want to learn. And then we do the didactic piece from there, which is more of, I guess the traditional PowerPoint that could have a lot of the sites and sources and things like that would be in there, could be more traditional. But I love interweaving with some engaging, fun content as well.
Nice, nice. And I just in doing some research, I understand that you use the story. Speaking of stories, use the story, The Giving Tree. First of all, it's one of my favorite stories by Shel
Yep.
Silverstone. Love
Yep.
that. Love that book. One of my favorites as a child, and even as I've grown up. And I've used
Yep.
it in conversation with parents that I used to work with in public schools. So I'm curious how you have used that story to discuss boundaries and ethics. Can you walk
Yeah.
us through how just a simple children's book, something that isn't necessarily very detailed, can really lead to high level clinical breakthrough for a practitioner?
Sure, sure. Yeah. And I love that story too. I have it upstairs and love it. So it's actually a brilliant story on boundaries and almost what not to do, right? The tree gives and gives
Yeah,
and gives and gives, and then it has
there's
nothing,
nothing
right?
left. Mhm.
And so what we did is I looked into this a little bit because I just thought this was a great, sometimes simple is better, right? Sometimes
Right.
when you're dealing with this, and ethics and boundaries is actually a required topic in some states because it is
Mhm.
so important. Helping professionals oftentimes give so much of themselves that they become to a point of just burnout, compassion fatigue, can't function. So we need to make sure we're walking these lines appropriately. So in that example of the giving tree, you're showcasing, hey, that tree is given everything and then can't give anything else. And you don't want to be like that. Now, taking it a step further, I did some research and it's another book that's an alternative ending to the giving tree that I found out there that we incorporate that because it actually showcases what's a better thing to do than continue to do that. How can you build a boundary? So we interweave that. And then I have my speaker take it from there. And again, the more didactic part, the part that we're talking about communication styles, techniques, what do we ethically need to do? Move into that. But we've started with the foundation of, hey, look, this is kind of what not to do and what to watch out for. And here's how, you know, you want to think about things.
Very nice, very nice. And I honestly would not, now that you've explained it that way, I completely get it. But in reading it or even using it, like I said, in my own practice with families, I had not necessarily seen it that way. But you're absolutely
Right.
correct. And I can really see how you use just a simple book with simple, topics in it to really dig deeper and allow practitioners to use that and understand how those ideas really affect their everyday work with patients.
Exactly. Like that, that wouldn't be the whole 6-hour day or whatever, but it would
Mhm.
definitely be maybe, 15 to 30 minutes of let's talk about this. Let's
Yeah.
look at this and show, this is not good. This tree gave everything and had nothing left to give. Now let's look at an alternative ending where the tree didn't give everything and what does the tree still have left? you set this stage, and then again, you have people's attention because, they're not thinking that they're going to have a CE with the giving tree. You reel them in, and then you teach them with the didactic piece, which with all the, the PowerPoint and everything else that you can bring into it.
Very nice. Very nice. I like that. So, Anne, I know we've already talked about the giving tree and that being one of your favorite CEU sessions to provide. Can you discuss any of your other favorites? Talk about how your students, how they experienced it, and what was it like to give those presentations?
Sure. Yeah, a few come to mind. So I actually had heard of an Atlanta actor. Her name's Carolyn Cook, and she very well known in the Atlanta actors circuit. And she was a caregiver for her mom. Her mom has since passed, but she was a caregiver for her mom. And it was a dream of hers to write a play on dementia. And I was always looking for an actor that I could partner with that would do something like this. Because back in the day, when I was first doing CEs with the elder law attorneys, I had a social worker who came up and said to me, if I hear another CE on dementia, I'm going to lose my own mind. And I'm like, that doesn't mean you stop doing CEs on dementia, right? That means that you have to find a way to teach this stuff differently. So I'd always wanted to partner with an actor who could write a play on dementia. And so I was like, let's go to lunch. And so in my prep for lunch, I'm sitting there thinking about, what do I want this play to look like? What do I need to have it in there for the boards? What would I want it to look like from that perspective, from a CE perspective? What was really cool is that because Carolyn had had so much hands-on caregiving experience, both with her mother, but she also cared for her grandmother who also had dementia. So we come together, sit down at lunch. I share with her what I would want to see from a social work perspective in there. What is it like for a care partner as they're caring for their mom with dementia? What can you showcase a little bit of maybe what the person with dementia is feeling? Can you showcase that? So Carolyn put together about a 20-minute play that showcased, she played all different parts in this 20-minute play. She showed herself caring for her grandmother as like an 8-year-old. She showed herself caring for her mother as a middle-aged woman. She showed the perspective of the person with dementia and the fear they have. And so every time and the play's about 20 minutes, and then we follow the play again, usually with some kind of didactic discussion where, again, we're bringing in the PowerPoint piece and the articles and the expert stuff. And I think what our learners have told us from that one, it's such a brilliant way to look at, again, all the different perspectives. And Caroline was able to capture it so perfectly because she has been in these shoes. She has been a care partner for her mom. She has helped care for her grandmother who had dementia. She sees the fear that her mother with dementia went through. And then again, weaving the parts that we need to have for the board where we bring in the evidence-based pieces, the articles and all of that. But then you're also showcasing firsthand what these people are going through. Mm-hmm. Very, very moving. So that's one example. Another example I like to share is I partnered with a cancer survivor who wrote a musical about his diagnosis and ultimate survivorship and everything in between. So it was the treatment, it's diagnosis, treatment, and ultimate survivorship. And he has a musical on it. And so what we did there when we partnered, we really talk a lot about clinical empathy. We traveled the US and presented this all over for a while when we were still doing things back in person. And he recently presented with CEU Creations as well. But we often talk about clinical empathy. Again, not seeing a patient as a number or a diagnosis. They are a person. They have dreams and desires and purposes. And it is your job as a clinician to tap into that. So that was another favorite one of mine because his music was just so moving and really showcased, especially when he talked about like getting the diagnosis of cancer and how we talk about like the roller coaster of emotions. His music showcased that, it was sad. And then it was pounding on the keys where he was angry, and he was so good at doing that and getting that across. So that was another one that comes to mind as well.
Very nice, very nice. Well, and you've got me wanting to log on to CE Creations right now, just because even in the first example, being able to understand dementia from all of those different levels is much different than just you telling me about it.
Right, right. Yeah. Because
It's
you or
impactful
I
work.
could get up there as a clinician and,
Mhm.
talk about it. And
Right.
we do have that clinician talking about it as well. But we do try to weave these other things in so that it's actually, I think it makes it richer and it's actually making more sense to the
Absolutely.
learners.
Absolutely. And for me, with my type of learning style, being able to experience it instead of just listen to you tell me about it is a completely different experience.
Right. Right.
Awesome. We'll be right back after a word from our sponsor.
Whether you're a longtime or first-time listener to Behavioral Health Today, you're probably familiar with Triad, the company that brings you this podcast. But you may not know that Triad also hosts a community for current and aspiring behavioral and mental health professionals, featuring trending content and education and career resources, all for free. If you are a behavioral or mental health professional, or you're studying to become one, join more than 80,000 people on Triad by claiming your free professional account today. Visit us at halotriad.com/BHT. That's halotriad.com/BHT and join the Triad community today.
So, and with over 20 years of experience, I know that you have seen the transition from doing lots of live in-person trainings or CEU sessions to now most things are available online, through live webinars, Zoom, that kind of thing. What do you think are the advantages of taking it to an online platform? And is it a better situation for learners?
Yeah, yeah, I think so overall. COVID really changed the landscape for
Yeah.
us. Before COVID, I would say we were 95% in person. Georgia, where I'm based out of, although now we're national, but I am based in Georgia. And when we used to be in person, Georgia is one of the strictest states for social workers and counselors, where you had to get like 25 of your 35 had to be in person back in the day. When COVID hit, it was I tell people it was kind of like turning a cruise ship around overnight, because we
Yeah.
went from about 95, 99% in person to about 99% online. And we do online in two different ways at CEU Creation. The main way is through our live stream events, like we are right now, live on a Zoom and interactive that way. And then we capture those and they become video on demands that people can then take as a video on demand too. So they have that option as well. I think the biggest advantage of the live streams, well, I think there's a few. First is our speaker pool, where I used to be really limited to like who's around Georgia, and it would cost a lot of money if I wanted to tap into a speaker from other states. Gosh, the world's my oyster now, right? I can reach out to people anywhere and get incredible speakers. And that has been one of the biggest advantages. I think another huge advantage is also for our helping professionals. Sometimes it's difficult, especially for those that might live farther away. Maybe you're not close to a big city. You didn't have great CE resources, and now they're you're literally at your fingertips, at your computer.
Absolutely.
You don't have to drive somewhere and schlep somewhere to go to a CE. You can go on your computer, you can log in, and you can get that experience by sitting in front of your computer. But it is what you make of it. That's what we were talking about. You have to
Mhm.
be engaged, you have to, pay attention and really want to learn and take something from it. But I think those are two of the really big advantages.
As a learner, I completely agree
Yes.
with you. I used to only do like the larger national conferences, like the school social work conferences,
Yeah.
or like the large NASW conferences, because it was the biggest bang for my buck. I could get them all done within a shorter amount of time. But I mean, again, we're having to travel all over the country to make that happen. And so being able to find companies that offer online CEUs that I can do maybe in a couple of hours, like half of my day, or during my lunch
Yeah.
break or something like that, makes it a lot easier to gain those CEUs and not wait until when they are due at the end of the year.
Right. And I think another thing with that too is with most of our brands, we have what we call unlimited bundles. So CEU Creations has an unlimited bundle where,
Nice.
again, another one of our big, big missions is affordability, because we know, again, these helping professionals are not millionaires.
Mhm.
And so affordability is very big across all of our brands. It has been at CEU Creations since we started. And so we have a bundle that for 225, at CEU Creations, you can take as unlimited CEs for a year. So,
Yeah.
and as a social worker, 225 for unlimited
That's
CEs for
really
a
good.
year. Sometimes you can't get 5 CEs for two
Right.
something. So that is a real feather in our cap, so to speak. And most of our brands have some kind of bundle like that because we do believe in, kind of giving back to these helping professionals and the affordability of CEs.
Very nice. So, CEU Creations has recently joined Level Education Group
Yep.
alongside CE for Less. Can you talk to us about that partnership and how it is really serving the full ecosystem of a professional's career, taking it from just compliance to community?
Absolutely. So I've talked to Level Education Group for about 2 years back I think I started talking to them in 2021, and CEU Creations wound up joining Level Education Group in 2023. And I like to describe it as two puzzle pieces coming together because if you look at Level Education Group, it was actually CE for Less was their main brand at the time. That was text-based CEs. And so basically like where you're reading and then taking tests on what you read. And it was started by Dr. William Cook, who's a psychologist. And he started for very similar reasons to me to try to improve CEs, make them different, more engaging. He did it through the world of like what I would call reading, text based. And then CEU Creations brings that live piece to that. So it's like two puzzles coming together. And what was really cool, I'll add this in because when we acquired Triad, Level Education acquired Triad in 2025, they really have that exam prep
Hmm.
piece in there. So now you've got, I always say we talk about from aspire to retire, and it's like three puzzle pieces coming together because you've got that part, when people are beginning their helping professional journey and they need to get licensed and they've got to pass that exam. And then they pass the exam and then they have the CEs. And we have all different types of CEs now, again, within Level Education. CE Creations has the live stream, AATBS has live stream. We've got CE for Less that has the text-based. And so it's all of this wrapped into one. And I think it's so exciting about all the differences we can make in that professional's life from aspiring to retiring.
Absolutely. And when I learned about the companies joining and the how everything is going to come together, it really is a interesting idea. Like you said, just the aspiring to all the way to the retirement phase. And I've not, of course, I'm not quite to retirement yet,
Yeah.
but I've been through all of those stages and I'm actually having a piece in at least the first couple. I work with AATBS too. So it's pretty cool to watch the evolution of CEUs go from stuff that's not necessarily that interesting, or I can't necessarily move it or use it towards what I'm doing today, to being able to just look online and find live events because many states do require us to do things live these days, even if it's not in person in a building. You
Right.
still have to do a live webinar or something that is live. And a lot of the things that I found online are not necessarily live. A lot of them have been, something that's taped or something that you read. And so it's really nice to see that there is some diversity there and being able to get your CEUs that you need.
Yeah. Yeah. I'd say about half the states have some sort of live requirement for either
Mhm.
social workers, counselors, psychologists, MFTs, all there's some sort of live requirement in about half the states. So yeah, that's, one of the benefits I think of having that as a choice and knowing, hey, if that's a requirement, you've got it. And some people
Yep.
just prefer, kind of to be in that live stream environment so that they can interact with the presenter or they can interact with colleagues, things like that. It's just all personal preference, but that's why I love the across brands because we kind of have whatever you need for your requirements
Mhm.
and then whatever you prefer, we've got it. Like
Very nice. Very nice. Very nice. So I know that you guys serve nurses, social workers, case managers, psychologists, and more. Everybody within that helping professional realm. What are some of the common threads that you see across all of those helping professions right now?
yeah, so I think when you think about the helping professionals that you just talked about, I think, we all have to have this continuous learning. We all need these CEs, right? And I think a common thread is, most of us didn't go into these fields to become millionaires. We went into these fields because we have a heart for this and we care about what we
Yeah.
do and we care about our clients and we care about our patients. And I think we care about changing and affecting outcomes, changing best practices, keeping our learning up so that when we are sitting across from our clients, we can truly make that difference. So I think that's a very common bond across all helping professionals. Then what I have found too in the different CEs, especially when you're talking about live streaming, you do get some of that interactive activity in chat or maybe even live stream people talking. You get different perspectives because a social worker might have a different perspective than a counselor, who might have a different perspective than a psychologist. And I love hearing all those different perspectives that people bring as well.
Very nice, very nice. Actually taking that a step further, as you grow and evolve and continue to work with level education group, how do you take that vibrant, that personable that the brand has, that the identity that the brand already has, how do you keep that and grow it without losing that level of intimacy that CEU Creations has created?
I think we continue to be creative across brands. I really think that trying to incorporate, I don't know, just the creativity. I always say, again, that's a piece I love so much. Looking at, when I'm building the house, so to speak, building the course, we have the things that we have to have in the house for the boards to keep it standing up and all that. But how can I weave these creative things in? And now we have multiple brands and multiple formats in which to do that, right? So CEU Creations does it through live stream, but we can also look at that, through the lens of text-based. How can we make that a little bit more engaging and fun? Are there, can we use some gamification? Can we use, what can we do to make that a little fun and a little different? So there's always things going on in my head that, and I think taking it across the brands just opens up a whole new world and makes it more exciting.
Absolutely. Absolutely. I'm looking forward to what the next step is. What does that look like? So looking a few years out, where do you see the company expanding to? Are there untapped areas where you guys can expand and look more in that experience layer? Add something else there.
Yeah. And you bring up the word experience. That's really good. Cause I always will say we get so used to calling them CEs or events, but I do like to say it. It truly, what our goal is to make it an experience for the learner so that, they think back, maybe they've gone to a CE and it's been a year or two, but they think back to it and they're like, oh, that was so fun that day that I heard about this perspective and learned this. So I think, as we continue to grow, I think the sky's the limit in terms of adding that creativity. We have a really, really awesome team. We have multiple social workers across Level Education Group brand. I think there's 5 of us all together. And what's also cool about that is, I worked, as I mentioned, mostly in medical social work with geriatric clients, but several other social workers that are on our team work on the school social work side, mostly with kids and juvenile clients.
Yeah.
So I love how if we bring that all together and as we plan these CEs, it's like just spreading that rainbow of creativity. And I think the sky's the limit that we can go to on that piece.
Awesome. Awesome. Okay. So for professionals that are listening, that are interested in learning how to take things for the next level, what is one tool or one habit that they can use today to draw out the best stories of the clients that they serve?
Yeah. So there's several things. When I was practicing medical social work, and it gets crazy. And as a dialysis social worker, you're boom, 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 boom. You're sitting with all different patients, with all different needs.
Mm-hmm.
And sometimes I would try when I would try to remind myself, oftentimes for me, it's a mundane, it's just my everyday, right? My everyday is running around talking to all different clients and patients and trying to figure out what are the resources? How can I counsel them? What do I need to do? But oftentimes we're sitting in front of a client or a patient on the very worst day of their lives, right?
Yeah.
So sometimes we just need to kind of take that step back between clients, kind of take a deep breath, remember, hey, this might be a mundane day for me. This is same old, but for my client, this could be the worst day of their life or this. Yeah. So you really want to put yourself in that space. And sometimes that's hard to do because you're just dealing sometimes with crisis after crisis. So that's one thing. The other thing I would suggest, we all have a story and we all have a passion. And I would suggest when you are sitting down and talking with your clients, and no matter what type of helping professional you are, like using the medical social work, for example, yes, I had to get medical history and I'm doing my psychosocial assessment. But then I'm always wanting to know, who are you as a person? I don't just want to know who are you as a patient or a client. I don't just want to know your diagnoses. What are you passionate about? What's your purpose? Ask those kind of questions and they'll tell you their stories. And then using that can help you as a clinician help them to map out what's important to them. Maybe again, using that medical social work example, just because that's my background. Maybe they're very sick and they're trying to get stronger and they can't do everything they used to do. Okay,
Yeah.
well, what's one or two things that we could work towards that would make the world of difference to them in terms of their passion and what means the most to them? So I think really stepping back and asking, you know, knowing your clients and patients as people and not just the diagnosis that sits in front of you.
Absolutely. And I will echo that. I haven't done dialysis social work. It'll be just 2 years this summer. But in that short amount of time, I learned really quickly that sitting and talking with patients, like you said, it for me, it's just let me just do this assessment that I need to do, or, plan out this plan of care that's due. I need to work on the things that I have to do. But for a lot of the patients, you might be the person that talks to them today, that
Right,
really asks
right.
them questions, that really wants to know what they have to say back. And so once I realized that piece of it, it really changed how I saw the type of work that I do. It
And it
really
can be
changed
hard
it.
because like
Yeah.
you're talking about, we have deadlines, we're
Hmm.
dealing with fires and crises a lot of the time. But
Yeah.
sometimes it's just that stepping back and maybe it's as you make a note in your psychosocial, you always want to ask them about their passion and what's their purpose? Before they got sick or before they were here, what made them want to get out of bed in the morning? What was their passion? And they'll
Yeah.
share that with you. And oftentimes they're sharing stories. And I think that's a great way to really learn about them and then, help them and learn their stories.
Absolutely, absolutely. And so on the other side of that, as the professional that is sitting in front of, let's say, a CEU Creations live session or live experience with you guys, what would you tell that listener? How do they gather the best information or receive the best experience from your work?
Oh, I think honing into the stories that we try to tell and really try to hear and listen to the stories that we're telling. And then also, what are the resources? What are the techniques? What are the best practices that we're going over that you can really extrapolate from the event and put into practice that day, the next day? I mean, we actually had a CE once. It was with a group of hospital social workers and case managers, and we were talking about communicating via improv, using improv techniques as communication. And that this is a new trend actually in the medical world. There's like hospitals are often bringing improv people in to talk about some of this. And it was really cool to see because over lunch, one of the social workers was struggling with one of her patients that day. And she tried something that was suggested in that CE and had a good outcome. So it's just, what can you extrapolate that makes sense to you that you can try and make that difference?
Nice, nice. Because I think that is really key. I completely agree with you because we go from things that aren't necessarily that interesting, but being in front of an experience, a full, experience that you can gain something from, really listening and taking those things in and really thinking about what you can take from this to not just get your CEU that you need for your
Right, not just sit
license.
there, not just be on your
Yeah,
phone, but you're
right. But
invested in
really
this
use it.
learning
Mhm.
experience that
Right.
hopefully is enhancing, hopefully your day of learning. It's a fun day off for you is our goal,
Yeah.
that you are enjoying the CE experience, but that you're figuring out, hey, this is a new technique, or this is a new way of practicing that I hadn't thought of, or maybe I had thought of it, but I haven't thought of it in 10 years. And maybe it's a little bit different now. So what can you extrapolate from that and put into practice on your own?
Awesome. Awesome. So, for our listeners, fellow practitioners who are ready to dive into interactive courses or follow your work, where is the best place for them to learn more?
Sure. I think CEU Creations Inc., INC. So it's CEU Creations Inc.com is our website. We are pretty active on social media, especially Facebook and Instagram. If they want to follow us there on CEU Creations, they can look at us there too. And they can also look at our other brands, CE for Less, AATBS, all the level education group brands, I think would be beneficial to these helping professionals.
Nice, nice. Well, Anne, I have really appreciated you speaking with us today.
Thank you. I've enjoyed being on. Thanks so much for having me, and I appreciate it.
And thank you to our listeners for taking the time to join us. You can follow us on our social media at Instagram, TikTok, LinkedIn, YouTube, and more at Behavioral Health Today. And if you like our show, make sure to give us 5 stars and leave us a review. As always, the resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.